Leonard. I'm a family nurse practitioner at the Manor Medical Clinic.
And I'm Dr. Willcox. I am a family medicine doctor here. One thing you might not know about us is that since 2018, we've been providing prenatal care up until 36 weeks. When you first decide that you're trying to become pregnant or first learn that you are pregnant, you should immediately start a prenatal vitamin. The gummies are perfectly fine.
When you first find out that you're pregnant, you can call and make an appointment. We usually will do a dating ultrasound between 8 and 10 weeks gestation. We primarily partner with the Unity Point OBGYN clinic in Clyde and Waukee. We will see patients until they're around 36 weeks pregnant. We have you do a visit with their clinic at 20 weeks to establish care. If any problems arise or anything comes up sooner, we might have you see them sooner, but we just decide that on a case-by-case basis.
The other nice thing about the 20-week appointment is that you actually will do your big anatomy scan up there, so that's nice. You get to kind of get to know them, and you also get that scan done at the same time. Next, Erin and I are going to talk about some of the frequently asked questions that we get asked during routine office visits. We've been asked a lot about the COVID vaccine. Both ACOG, the World Health Organization, and the CDC recommend that if you would otherwise get the vaccine, you should get it during pregnancy or while breastfeeding.
We get a lot of questions about medications that can be taken during pregnancy. There are several medications, both prescription and over-the-counter, that are safe for pregnant women. We usually provide our patients with a list of medicines to take for common ailments. If you're on multiple medications for chronic illnesses, it's a good idea to come in for a visit before conceiving to kind of go over these. And if you have any questions after you're pregnant, we'd be happy to see you to talk about those as well.
Another question we get a lot is about morning sickness, which is very common for pregnant women. Does not always occur in the morning, but there are some over-the-counter supplements you can try. B6 is pretty effective, as well as doxalamine, which is Unisom. Both of those are safe to take during pregnancy. If you're not able to keep fluids or foods down, you really do need to be seen, because that can be a signal of something more significant going on. So another question we get is about spotting or bleeding, especially during the first trimester. It can be normal due to increased blood flow to the cervix.
But if you have any spotting or bleeding, we would want to see you to further evaluate that and order testing if needed. So for the typical course of prenatal care for a normal pregnancy, we usually see patients every 4 weeks up until 28 weeks, every 2 weeks until 36 weeks, and then at the end of the third trimester, patients are usually scheduled weekly. If you already have an OB provider that you've seen in the past and you'd still like to deliver with, we're happy to reach out to them and work with them as well.
So there's a lot of benefits to doing your prenatal care locally. First, it saves on trips to Des Moines. Secondly, it's nice because then we can also follow up with your babies after they're born.
Another benefit of doing prenatal care in our clinic is the continuity of care that you and your family are able to receive. We're happy to see everyone in your family for ongoing issues or anything that you might need.